Hi, I'm Dr. Neil Thompson, chiropractor at Align for Life, the Isle of Man's Family Wellness Clinic. And today I want to share with you one of the most common causes of low back pain that is so easy to fix. And it's so easy to fix that it's worth a quick video posting. So here it goes. Ready for it? Yes, it's the way we stand. And I am going to show you a common postural stance that causes low back pain. So as you can see, yes, that's me with the selfie stick. You're not imagining things. So when we're standing, what's very common is as we get a little bit lazy and the sort of core muscles don't engage so much, our pelvis starts to slide forwards. All right, so I'm going to try and angle it down so you can see better. So our pelvis, instead of being back, starts to come forwards. It starts to come forwards like this. And as soon as that happens, it puts a lot of pressure on there on the low back. You end up getting this sort of sharp angulation in the lower back area here. Instead of it being straight, so you should have a straight line that passes through the ear, ear, shoulder, hip, knee, and ankles. A straight line should pass through all those points. We end up with a sort of a tilt like this, okay? Pelvis comes forward and then it goes back again, putting a lot of pressure then on the lower back. And often it's simply because we're locking our knees. It's as simple as that. We lock the knees, the pelvis comes forward, all right, and the lower back now takes a much sharper bend than it should do, and that loads the facet joints in particular. Muscles now also are not engaging the way they should engage. Your core muscles become weak, and it's often associated with the locking of the knees, which causes the pelvis to come forward. So an easy fix, simply soften the knees. Soften the knees, bring the pelvis back, and you'll find then that you have that more upright posture with your head facing forwards, looking at the horizon, shoulders back, ears in line with the shoulders again, all right, and ears, shoulder, hip, knee, and ankle now all in a straight line. It helps then also just to be intentional about focusing in on your feet. So when we tend to slide our pelvis forwards, when we lock our knees, you'll find that often the feet, all the weight gets pushed onto the heels. And again, it's that classic lazy posture, isn't it? So as we learn to soften the knees, bring the pelvis back, you should be able to rock just gently between the front foot and your heel. So in between the two, okay? You should be able to rock between the two, all right? Okay, as the knees are softened and the pelvis is back, you should be able to rock slightly. And that's when you know your weight through your feet is correct. If it's mainly on the heels, chances are your pelvis is coming forwards like so. All right, so soften the knees, bring the pelvis back, shoulders back, nice straight line, and that's going to reduce a lot of loading and pressure off the lower back area, and can obviously then reduce low back pain and even sciatica and a whole host of other problems. I did this a lot at school, standing in assemblies, okay, and various other things. And just simply doing that really actually helped a lot for me, and I know it's helped many patients. So that's my top tip for today. Soften the knees, keep the pelvis back, and make sure your feet can rock slightly between front and heel. You're not just locking onto the heels. Okay. That's my top tip for today. Take care. Bye now.